I wanted to give you a little background, though, on the fried chicken song. So really, that is kind of an accurate description of my upbringing in Georgia, because the song is about Georgia. I was raised on about 7 acres of nothing but pine trees. So really, the only thing that really wouldn't be the accurate thing is the beer every Friday night, because I really don't do that. Sweet tea is really my splurge drink of choice. So I grew up, again, in rural Georgia. My mom and dad had a restaurant, and he also talks about fried chicken in the song. And what was one of the things that my dad made at the restaurant? The best fried chicken you've ever eaten. So my mom made all the sweet tea there. She made the best cobbler you've ever put in your mouth, peach cobbler, which anyway, so that song was just me. But interestingly enough, even though I worked there even when I was a kid, through my teenage years, even through college when I was back at home, ironically, I ended up being a nurse and a diabetes educator. So I rarely eat that kind of food anymore. I do eat it. I eat it occasionally because I'm all about moderation. But I ended up becoming a nurse because over my childhood and my teenage years, my dad had some major health scares. And it wasn't because he was eating the fried chicken. He didn't eat a lot of what he actually served, but he stood on his feet all day long on concrete. He smoked. He was a smoker. Smoking killed my dad, but he was able, through modern medicine, to live to the age of 76. So I'm thankful for that. But because he had a poor diet, and he did not exercise. Exercise to him was going to the cafe working all day. Well, that's not the kind of exercise we need. So all the things that they kept saying, oh, it's genetic, you're going to get all this stuff that your dad had. Well, guess what? I don't have any of it. I don't have any of it because I don't do what my dad did. I don't smoke. I rarely have anything to drink. I try to take good care of myself. I do eat. I do have splurges. They know I like some good cheesecake occasionally. But I just don't do the things that he did. So if you have bad habits, we've got some great programs within Blue Cross Blue Shield that I'm going to talk to you about today. Great programs, great services at no extra cost to you or our members. And so I want to talk about some of those programs today. Another reason you need to get that biometric screening. You may or may not need one of our programs. I hope you don't. But if you do, we can help, okay? So, speaking of our programs, so as Michelle said, I am a clinical account consultant for Blue Cross Blue Shield. I am a registered nurse and a diabetes educator by trade. But today, like I've done in the last several years, I don't even know how many years I've done this at this point, I have reviewed our internal programs and services. So these programs are great because it really doesn't matter where the member is on their health journey. They could be perfectly healthy. They kind of might be in the middle, or they might have something acute and very stressful going on. It really doesn't matter where that member is. We have some type of program or service that is available for them. So I did pull me some little rodeo taglines and basically wanted to say that you could be riding tall in the saddle. That would be the healthy person. You might be kicking up a little dust, which means you might have a little something brewing, or you might be confronting a difficult situation and you need to take the bull by the horns. Again, we have programs in place that will help. The programs that we have, I will say, again, regardless of the issue, they promote quality. They're just great interventions for our members. And at the end of the day, they're cost effective for the member and the group. But again, it optimizes their health. So the more you know about these programs, the easier it is to steer the herd in the right direction. So because I have reviewed these programs over and over for several years now, this ain't my first rodeo, and it's not your first rodeo either. So let me see a hand. Let me see a show of hands. Who has heard this information before? Clinical programs for Blue Cross, case management, chronic condition, my Blue Cross. I think who's new in here? Who's new in here this year? Okay, so kind of speckled throughout. Okay. But we're going to put you to the test right up front. Typically, I get up here and I go through the programs. But when I walked in today, y'all are kind of getting tested. You're going to get tested again. I will not lasso if you get it wrong, I promise. But we're going to kind of change things up a little bit. Who knows about the show Yellowstone? Woo! I heard a woohoo, yeehaw. Okay, so I took the main characters of Yellowstone, and I have created scenarios, health scenarios, kind of based on some of the stuff that went on with the show, and I want you to tell me which program you would plug these people into, okay? I am going to give you a few other little summary tidbits at the end. I will kind of shoot through the programs, but most of you have heard of this information more than 1 year, and we're just going to see how much you remember. So this shows the actual programs that we have. Now I want you to write down quickly, or if you think you can remember it in your head, that's fine too. Other programs that would be ones that you could choose from that are not listed, because these are more like programs. Then we have some other things that I would call as a service. So My Blue Cross account is going to be an option. Okay, I don't think that one's listed up there. My Blue Cross account, Blue 365, oncology navigation. All right, so My Blue Cross account, Blue 365, oncology navigation. Those are also options that you can choose from, okay? If somebody knows the answer, just shout it out. Okay, Lloyd has been on the ranch for 40 years. Does anybody know who Lloyd is? He's like the oldest ranch hand in Yellowstone, okay? He's been riding those bucking broncos, roping cattle, and baling hay for years. He has a lot of musculoskeletal pain from all of his hard work. Which program would you get Lloyd connected to?
Chronic condition.
Yes, chronic condition management, okay? So if you get him enrolled, and again, because some of you may need some of these programs, but if members call and they're like, hey, I got so-and-so going on, oh, Blue Cross has got this program that will be perfect for you, okay? The more you know, all right? So this would get the member additional support and education from a nurse. He would have contact with one-on-one with a nurse because he has a chronic condition. MSK is one on the list that we will get to. I'll show you the list when we get through all the questions. Okay, so in season 2, Rip, we all know who Rip is, all right? Rip gains a little weight. I mean, he's just kind of buff, but I think he did gain a little weight. He's probably stress eating because his wife is a little bit of a piece of work. We all know who Beth is, okay? We all know who Beth is. Okay, so this contributes to a little bit of elevation in his blood sugar, all right? It's a little elevated, and it's starting to put him in that pre-diabetic category, all right? Again, he's dealing with Beth's crazy tendencies. She's given him a little high blood pressure. He's got a little hypertension on the rise, okay? Which program would you recommend for RIP? At-risk health coaching.
I'll be glad to call and.
Okay, we have a volunteer. I have his number, actually. All right, so Rip has some conditions that are brewing. He needs a little prevention to reverse course, okay? So that's what at-risk health coaching is for. All right, so number 3. So I know technically this did not end well in Yellowstone, but I'm going to do the first part of what happened to her. So Casey's wife was pregnant in season 5. Okay, now I could have wrapped all kind of scenarios around the car wreck and everything that happened to her, but she was pregnant in season 5. So after she got her ultrasound and she found out that, at the time she was having a viable pregnancy, what program would you have recommended for her? Maternity management, baby yourself. That's right, because this program promotes prenatal care, okay, prenatal education. All right, so back to Beth Dutton. Okay, Beth is a cigarette smoker, among many things. I've decided that Beth has asthma, because why not? So Beth is a cigarette smoker, and she is exacerbating her asthma, okay? She is like taming a wild Mustang, but she needs help to understand her triggers as well as medication adherence to take her inhalers, all right? So which program is best suited for her because she is a smoker and she has asthma?
Specialty. At-risk.
I'm actually tricking you there. It's chronic condition management again. It is chronic condition. And again, I'll show you the list of those when we get through the questions. So asthma is one of the core conditions listed in chronic management, chronic condition. All right, question 5. All right, early in Yellowstone, y'all may have forgotten about this. I don't know. I couldn't believe I actually found this. John Dutton has a diagnosis of colon cancer. Do y'all remember that? She does, because I think she is on it. Okay, which program deals with acute events and provides support for people who are in the midst of acute events. You could do the specialty case management, and then it's kind of an umbrella. So there is case management, and then depending on what the member is going through, we do have specialty portions of case management, and oncology would be one of those. So that is correct. Good job. All right, so
And I'll be glad to.
I have him on speed dial. Okay. All right, so we're going to continue with John Dutton here. So, and again, I could have done a lot of scenarios around him. So once he is treated for his acute event, he then goes into another program that will assist him. He's stable now, okay? Remember, he went to I'll tell you that after I do this part because I don't want to ruin it. Okay, so he's stable. He's over his acute event. He needs help with medications, appointments, just kind of staying on top of things, okay? This particular program also wants to stay on top of a member that might have some type of exacerbation. Maybe they start having some symptoms, and so they can loop them back into case management or their doctor. So which program, when he's, came out of that acute phase, who would he have been talking to? Who? Oncology navigation. That was the one that I said to write down. Yeah, so once someone has cancer, they've gone through that acute phase, and they don't need that one-on-one kind of all the time interaction anymore, we would then transfer them to oncology navigation. It can be done by case management. It could be done by the physician. There are a lot of different ways to kind of merge into that particular program. But oncology navigation is where he would be because he's over his acute phase. So, and again, it's just that ongoing support kind of at a lesser level, and the time frame gets spread out a little bit. So for him, he did actually start having some problems. He did have some exacerbations. He thought his cancer was back, and he started coughing up some blood. Does anyone remember? So at that point, that's when he would have gotten referred, again, back to case management or his doctor. Does anybody know? I'm going to say you can't answer. You cannot answer. Does anybody know what happened to John Dutton when he thought his cancer came back? Nobody remembers this part? The vet actually diagnosed him with a ruptured ulcer, and he cauterized it. So I don't recommend that. Go to the PCP. But anyway, for him, the vet ended up diagnosing that. So, all right. So all the ranch hands need new boots, okay? They need new boots. Where should they look first for discounts on footwear? Blue 365, that's right. They have great deals for every aspect of life. Typically, they literally have like over 100 different options at a time. So go check. Again, I said this, I think, last year. I'm so mad. I did not know they had a discount on Sonicare toothbrushes. We love Sonicare toothbrushes in my household. I missed the discount because I did not look there first. Okay, so this is the last one. In order for members to saddle up, ride off into the sunset on a happy trail, which site should members get connected to in order to stay up to date on their health overall, because there's a plethora of information here, claims, get reminders, great resources? Where should they be? My Blue Cross account, that's right. So speaking of My Blue Cross account, let us see a show of hands on who has a My Blue Cross account. Not bad. Okay, I think everybody in here by the end of the day, you should come over to the table and have to show me your phone and show me that you have put the app is on your phone. I think that should be a requirement today. All right. Now, one of the things that I'm just gonna shoot through these real quick because I know I'm probably running out of time. So here is the information on Blue Care. Again, okay, this is in the past what we call Blue Care advocacy, all right? So I didn't put this in actually the questions, but Blue Care advocacy is fantastic because it is literally like having a coach and an advisor kind of all rolled up into one. So this is always a good starting point. Now, one thing I will say that has changed about Blue Care advocacy is and I'm not sure why this got changed, but we do not do warm transfers anymore, okay? So in the past, when someone would call in, we have Blue Care Advocacy. These people have a clinical background, and they are very, very well-versed in claims, okay? They know a lot. I had to go through a heavy, heavy claims training. And then we have customer service, who is literally claims, to some claims and benefits. But the warm transfers, when people would call in, you put your contract number in, and then if you had a gap in care, maybe you were late, it would then transfer you to one of these Blue Care advocates, okay? Or if you didn't have anything going on, it would transfer you to customer service because maybe you just have a basic question that you need to ask them. We don't do that anymore. So the Blue Care advocates are not receiving what we call inbound calls like that. Now when people call in, everything goes to customer service, okay? If for some reason someone calls in though, and they do need, maybe it is a claims question, and then the customer service person sees they actually have a need, they will route them to a Blue Care advocate if the member will agree to that. So there's still a lot of transferring going on. They're just not receiving calls on the front end necessarily. Okay, does that make sense? All right, but they are a great resource. They are a great resource and a great advocate, and they have a lot of good information that they can share with members. All right, so here is the chronic condition management slide. So chronic condition management really is kind of an umbrella. So health coaching is the lesser of the two evils, I will say, because just like RIP, gaining a little weight, getting a little hypertension, okay, health coaching is going to target people who are having issues with prediabetes, hypertension, and weight, okay? Those are the three targets for that particular program. Clearly, we want to be able to coach people, put a plan in place. We have a specific curriculum that we would use for each of those. They're all going to be very similar because of what you'd have to do to put those into reverse. But the whole point is to make some behavior change, healthy lifestyle choices, okay? Again, you can see that there are a lot of different people on that team, multidisciplinary. We have a lot of different areas that are covered within the team that would help those members. The next portion of that, once you break through and you end up in the chronic condition space, then technically you would be in the chronic condition management program. So again, that is a nurse one-on-one support, all right? The issues or the conditions are listed there, and you can see where asthma and MSK is listed, and then there are a lot of other ones there that we would help support a member on. For this one, I would say really the main thing that we're trying to accomplish or help the member with, other than just education, tools, giving them what they need to figure things out, understand their diagnosis better, we really, really want to prevent exacerbations in this space, okay? We don't want people running to the emergency room every time they have a symptom. We want to educate them. Again, they would have a plan, a curriculum in place, because we want to help them understand their disease process better, because at the end of the day, they are still in a space where they need to self-maintain, okay? That is the point of this program, is to teach them, give them the tools that they need so they can self-maintain themselves over time and hopefully be able to stay as healthy as they can within that window of being in chronic condition, okay? All right, the next one, we do move to case management. And again, here, things are getting a little more complex. So for this particular program, again, one-on-one support with a nurse, so that's great. This is going to get a little more complex because now you're looking possibly more at benefits, you're diving deeper into the diagnosis, there may be discharge instructions that are involved, but again, these nurses are great support and they have tons of resources and they are ready to help members in any way that they can, financial, daycare assistance, food, transportation, you name it. Again, these nurses are a great resource for the member. The next one is oncology navigation. So again, we've already kind of talked about this. Once the person is not acute anymore and they're more stable, they would transition into this particular program. And if they need to transition back out, then we can obviously help with that as well. Again, part of this is a cost containment and just staying on top of things with the member because, again, in this particular space, we want them to be as healthy as they can. This particular team, again, multidisciplinary. There may not necessarily be registered nurses. We have a lot of different people in this space, appointments, medications, resources. Sometimes somebody might just be stressed out, emotional. Maybe they need to, get in touch with their EAP. Whatever it is, the people that are in this space on this team, they're going to assist the member the best way they know how. The last program is Baby Yourself. Again, we want the best possible pregnancy and delivery for mom and baby possible, and we feel like with this program, that is a possibility. We want really good clinical outcomes, clearly. Hopefully that will reduce cost. With this particular program, again, you have one-on-one support with a registered nurse. These nurses typically do an upfront assessment, hopefully within, I say, first, it's kind of a tricky. We want people to enroll within about the first trimester, but the problem is if you don't really know what that is, that's really 12 weeks. So that's going to be hard because a lot of times people are going to be more into like the 16-week or maybe even sometimes 20, depending on when they've had their ultrasound. But regardless, we want people to get enrolled into the program as quick as they can. They have a big assessment that's done up front, and then the nurses typically call every trimester to talk to the member. Now, the member can call and talk to the nurse as much as they want to, because sometimes you go to the doctor, it's overwhelming, the doctor's in a rush, you leave and you go, oh, I had this question, I forgot, I really wanted to ask them. Then you call your Baby Yourself nurse, okay? For all of these programs, I'll go ahead and say there's a lot of different ways to register. You can online, we send out phone numbers, we send a lot of different communications in the mail. We have apps that you can join programs with. If you're on the My Blue Cross account, you're getting announcements. You're getting things fed to you that are relevant to you. So then you would have that information in front of you as well. But another great thing with this is they send out awesome gifts. So that's fun. Everybody likes to get a present, especially a mom. It's like getting a little treat. So another great program. I tell people it's better to be enrolled in this than to not be enrolled in this because the education that they give is priceless. I was a labor and delivery nurse way back in the day, and I've listened to these nurses talk to the moms. They are fantastic. So we really want this particular program, just like the others, to be promoted as much as possible. So if anybody has any additional questions, I'll be here all day. So come see me.